Sponsored by the Carpal Rx. Every year in the United States, over 20 million people undergo general surgery. Surgery is not without risk. In fact, some of the risks can be significant. Among the most significant risks are complications of anesthesia, bleeding during surgery, blood clots or deep vein thromboses, post-surgical infection, difficulty breathing after surgery, delayed healing, and even death. Complications of anesthesia are usually related to the adverse reactions to the medications used. Also, insertion of the intubation tube to allow breathing may result in aspirating fluid. Another reaction to anesthesia can be a dangerous change in the patient's temperature. Bleeding during surgery is a complication that can arise from the smallest microsurgery to the very large procedures required. Oftentimes, excessive bleeding will require a blood transfusion, and this itself has other complications associated with it. Surgically induced blood clots, otherwise known as deep vein thromboses or DVTs, are a very significant risk during surgery. A blood clot can turn critical when it travels to the lung and causes an embolism, or if it travels to the brain and causes a stroke. Another complication of surgery is post-surgical infection. In spite of the precautions taken by the surgical team, infections do occur, and sometimes they can be very long-lasting, sometimes 1 to 2 years after surgery. Some patients have difficulty breathing after surgery. Once they're removed from the ventilator, it's not uncommon for the doctor to realize that they will need more extended ventilation, especially if the patient is a smoker or has lung disease. Delayed healing is another problem with surgery. Some people heal faster than others, but if you have chronic illnesses or an immune system problem, or your blood glucose is uncontrolled, as in diabetes, you may find that it takes longer for you to heal. Finally, all surgery carries the risk of death. While it's not very common, about 1%, that does account for about 225,000 deaths following surgery in the United States every year. If you have symptoms of carpal tunnel syndrome, are you really considering having surgery to relieve those symptoms? You've tried wearing splints and tried various medicines for the pain, and perhaps even tried going to a massage therapist once or twice. If you do have the symptoms of carpal tunnel syndrome, you owe it to yourself to try the Carpal Rx first and take advantage of the 60-day free trial offered. The Carpal Rx was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal Rx automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal Rx will do the rest. The Carpal Rx always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal Rx is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal Rx at carpalrx.com.